Hi, I'm Erin Anderson, Managing Editor of the CanFitPro magazine. Today, we get to speak with Tracie Smith-Beyak about strength training and the pregnant athlete. Tracie is one of the primary authors of our CanFitPro online course, A Fit Pregnancy. So welcome, Tracie, and thank you for joining us today.
Hi. Thanks for having me.
Yes, thank you. Just a little bit about Tracie. Tracie is a master trainer, presenter, and author, and member of our advisory panel here at CanFitPro for the 2019-2020 year. She specializes in prenatal fitness, biomechanics, rehab, and athletics, and she has made regular appearances in fitness, medical, and business industries for over 23 years. Tracie has been in the fitness industry for over 35 years, training, teaching, and certifying trainers and instructors worldwide. So thank you, Tracie, for joining us, and I look forward to this little chat about strength training and the pregnant athlete. So one of my first questions for you, Tracie, is it safe for strength training in terms of using moderate to heavy loads for a pregnant athlete, especially if they have been training prior to being pregnant?
Absolutely. And this is a question I get all the time. And really, the prior part is what's most important. If they've been lifting for 6 months or more without incident, and that's an important part of that sentence, weight training is suggested, recommended. I fully endorse it as a trainer. But if they haven't been doing any, then really it's not time to start into heavy lifting. Light lifting, strength training, absolutely, but we don't want to start to get into the heavier loads during pregnancy. That's not the time. But if we get our seasoned athlete who's been training for more than 6 months and they have no injuries, then we're good to go. Technique and form, of course, is the single most important thing. And the load reps that they're looking at are important. So pregnancy is not a time to do a 1 to 3 rep max. That is not what we were looking for at that point. And this is due to joint laxity that progresses as we go through our pregnancy and physiological adaptations that take place. The other note, which is a general thing, is breathing. We don't want to be doing things like a Valsalva maneuver, holding your breath during lifting, because that can represent changes in blood pressure and heart rate, which can be not too good to the pregnant woman. So I hope that sort of opens it up. Yes, if you've been lifting heavy, you can continue lifting heavy.
Excellent, thank you. What are some of the general load guidelines for strength training for a pregnant athlete?
Absolutely. So I always like to refer people to the brand new 2019 CSEP pregnancy fitness guidelines that have just come out. And it's saying 150 minutes per week. And that's a mix of cardiovascular and strength training. So when we talk about frequency and load, this all comes into play. So they should be doing resistance training. That's great. I like to suggest between 12 to 15 reps, 8 to 12, or 6 to 10, not going below that. And of course, you're setting that up, your load, so that you would go to fatigue by the end of that rep set. So let's say you're doing 6 to 10 reps, your load should be fixed so that you're at fatigue at the 8th or 10th rep. And then as you get into several sets later, you might be only 6 in, but that's how you're setting your loads. I think that's, yeah.
Okay, yeah, no, that's perfect. That lays it out very clearly. What would be, I'm going to kind of divide this next question up, but what would be some of the risks associated with, or I guess some of the risks associated with strength training for during pregnancy?
Absolutely. Well, I'll start a little bit back. There's some good studies out there that say the risks are minimal, but the biggest ones that I like to, before we get into the ones that are in the guidelines, that I like to advise people are about mechanical changes that take place in the body as we go through 2nd and 3rd trimester. Your musculoskeletal system shifts, and I've got my handy hip that I'll show you in a second. And so heavy lifting in standard positions, you can't actually physically do it anymore. So it represents risk to the joints. the hips and pelvis in particular. So if we look, I can show you, I've got my little hip man right here. So if we look at this hip, it might articulate front and back, but as we progress through, this hip is going to externally rotate, and then you'll see our knee is no longer aligned. And if we go down the kinetic chain, either is our ankle. We can actually go up the chain and to the spine after that, and you can see that mechanically a regular squat isn't happening. Our foot placement has to change, and so we have to start thinking about what the exercises are. Along with that, with risks, are if we're integrating strength training that has ballistic or jerky movements. So let's think about a kettlebell swing, for example. You've got load and you're swinging it up and down. And as you swing that load, it puts stress on, say, your elbow joint and your shoulder joint, which are now lax and progressively lax as you go through. And that's with load. So we are going to put excess strain on those joints. So I would avoid things that are jerky or ballistic to stop from hurting those joints. And I would think about what the action is and what plane of action is required, because if the joints can't move on that plane anymore, you're going to get hurt. So then from there, you can move on. You can get into risks. You got within the guidelines, absolute risks, which say, you know, if this is happening, then you probably shouldn't be working out without seeing a physician or your caregiver, which your caregiver could be midwife, family dog, OB-GYN, whatever. So examples of that would be premature labor, placenta previa, preeclampsia, ruptured membranes, things like that. Incompetent cervix. All these things tend to be bigger risk in the third trimester rather than early on, but they certainly can present. We also have relative risks, which you probably should be okay, especially if you're safe, but we require a healthcare professional to give us guidelines on that. Previous pregnancy loss, hypertension, respiratory or cardiovascular disease, malnutrition, eating disorder, things like that. They represent risk unless we're working with another professional to make sure they're safe. But I'd like to go back and just talk about what the benefits actually of strength training are more than the risk, because benefits actually outweigh the risk.
Well, that's why I wanted to end with the positive. So yes, let's talk about those benefits.
So number one is we see far fewer newborn complications, right? So a pregnant mother, all she wants to hear is that I am decreasing the risk to my baby. And so that's huge, and that's across many levels. But maternal health benefits, we see decreased risk in things like preeclampsia, hypertension, gestational diabetes, delivery, urinary incontinence. Oof, that's a big one, right? A lot of people are interested in that. Depression, lower blood glucose, overall less weight gain during pregnancy, and decrease depressive symptoms. So we also cross into our mental health, not just our physical health on that. And then I think we just have to look at what the impact after the baby will be for the gains too. So a strong mother is going to have more stamina and more endurance and be able to lift all the heavy baby gear and baby, when the baby's on scene. So what you're doing in preparation for arrival is pretty important. Does that answer that one?
Yes, excellent, and thank you. Yeah, I thought we'd go from that short, to the more important, which is definitely the benefits. So yes, yeah, exactly. They definitely outweigh. Yes.
Yeah.
So thank you. Do you have any tips for prenatal athletic weight training that you could give us?
I absolutely do. So one of the big things, just to give you a trainer perspective here now, is I get athletes in, or an athlete can be a person who's not necessarily competing, but is just very, very fit and wants to maintain that. And it's a struggle for them to not be able to do what they regularly can do. But I like to think of this as a complete advantage. So this is a time not to work on lifting heavier loads, but to maintain, and more importantly, to cross-train and improve supporting athletic skills. And what skills? I'm talking about things like balance, mobility, symmetry, right, left, front, back, that whole thing, core stability, spatial awareness, and strength endurance as well. And what I find is when we work on these things during pregnancy, they come back stronger than they were when they went in. Because when they went in, they weren't necessarily taking enough time to work on these other skills. And now, maybe they're being forced to do that because of the pregnancy, but I usually see most of my athletes get their PBs after they've had their babies. True story. And then the other one that is a big one is pelvic floor. And so within the guidelines, the new 2019 guidelines, they make a point of listing this and targeting specifically, but pelvic floor muscle training really, if you do that during your pregnancy, will reduce your risk of urinary incontinence and some prolapse as well, which is important. However, I would like to say it's important that you get training, so proper instruction on how to do these things so that you're going to get the benefit from the training. So yes, the two key tips would be cross-train for better performance postnatal, and make sure you do your pelvic floor strength training along with the other strength training.
Excellent, thank you. Those are fabulous tips and great information. I think, you know, it's interesting that you say that some of your clients have had more of their personal bests after, because they have trained those things that they generally tend to neglect, right, prior to. So
absolutely,
it makes sense, but it's worth mentioning, and it's a great reminder. So thank you. Well, thank you very much for joining us today for this, and I look forward to talking to you in our installment 2 of this, which will be cardiovascular training for the pregnant athletes. So thank you, and look forward to talking to you again when we come back with that one.
Thanks so much.
Okay, take care. Bye.
Okay, bye.